So today we will deal with the adverse effects of the NSAID. Yesterday we had discussed about the mechanism of action of the non-steroidal anti-inflammatory agents, which is also a part of the Autacoid pharmacology is concerned. And we have learned that there are many type of the NSAIDs, especially the older NSAIDs like aspirin and other drugs. Of course, the preferential COX inhibitor like the meloxicam, which inhibit the both COX-1 and COX-2 type of the enzymes, and also the specific COX-2 inhibitors like rofecoxib, celecoxib, and so many other drugs. So, today we will see what are the adverse effects of the NSAIDs. So, the side effects.
Sir, your idea is unmuted.
Yeah, the adverse effects of the NSAIDs and the side effects are very prominent in the first generation NSAIDs, especially the first generation NSAIDs, whereas it is less common in case of the selective COX inhibitors, COX inhibitors, and also the many types the earlier these NSAIDs they have got many side effects, whereas the modern NSAIDs do have very less side effect. And apart from this one, they cause the blood loss in stools and cause the gastric ulceration, of course, gastric ulceration, and of course the nausea, vomiting, and sometimes the epigastric distress, and the occult blood test, that is the test in blood in the feces will come. The most important adverse effect is gastric mucosal damage. The reason being is the gastric mucosal protection is mediated by COX-1, means it is going to produce PGI2 and PGE2, and these two enzymes are responsible for the secretion of the bicarbonate ions, secretion of the mucin, and also the maintenance of the mucous membrane. So because of this thing, they have got the gastroprotective activity, whereas the earlier NSAIDs like the aspirin and other drugs are going to inhibit the COX-1 enzyme, and hence there will be less secretion of the gastric bicarbonate ions, and also the this mucin production will be drastically decreased. Hence, there is a formation of ulcers and erosions in the stomach. Especially the dogs are very sensitive to this thing. Apart from the human being, of course, the cattle which are suffering from the diseases like thylaria, anaplasma, etc., they are highly susceptible to the NSAID toxicity. So many times the hypersensitivity and the idiosyncrasy is also seen. Hypersensitivity and idiosyncrasy are also very common clinical sign. Very commonly they are all noted, and we can find the sometimes, especially in case of cats, they are also very commonly susceptible. Cats, many times the owners, they themselves will administer the NSAIDs, and